Good morning, everyone. We're going to start soon here and give another minute. Okay, well, good morning, everyone. Thanks for joining us today for this COVID-19 media availability meeting today. My name is Geraldine de Avila. I'm the new communications or media and communications specialist for the Washoe County Health District. I'm filling in for Scott today as he's taking some well-deserved time off. On the agenda today, we have James English, Regional Operation Chiefs for COVID-19 Response, and Kevin Dick, District Health Officer. And with that, I will pass it along to James. If you're ready, go ahead.
Good morning, everyone, and thank you for joining us today. Wanted to touch on both our testing and vaccination efforts. We are open for testing whenever government offices are open. So this week it was Monday and Wednesday. Next week it'll be Monday, Wednesday, and Friday. There is some misinformation out there that we'll be testing this Friday. We are closed in observance for the New Year's holiday. With that, do want to mention that almost 2 years into this pandemic, we had our highest ever positivity rate out of our testing operation on Monday. Our positivity rate out of the post was 37.9% for the day. So currently we are testing those individuals that are symptomatic or close contacts. We are not concentrating on pre-employment or pre-medical procedure testing or employment testing. We are really concentrating on those individuals that are ill, and it's obvious by those that are coming through our operation that the virus is continuing to spread throughout our community, as I'm sure you'll hear the health officers speak to next. But it is pretty sad information and disheartening to see such a high positivity rate coming out of our operation. Additionally, we are not weather dependent. Whenever we have an operation scheduled, we do have the means to operate no matter what the weather's like. So I do want to make sure that's clear. That goes for both our vaccination operations and our testing operations. To date, we're about 19.5% vaccinated in the 5 to 11-year-old population, and we've initiated vaccines on over 70% of Washoe County's population. Over 63% of Washoe County's population is fully vaccinated. So that continues to be great progress. Additionally, we have an adult 12 plus vaccination pod being held here at the Washoe County complex from 1 until 4 tomorrow afternoon. There's still appointments available. We'll have all 3 vaccine types available, and walk-ins are always encouraged and will be accepted. Furthermore, we continue to vaccinate inside our clinic as we moved our operations indoors. We continue to add capacity there, and to schedule a vaccination through our clinic, just call the call center at 328-2427. Next week, we go back to partnering with the Washoe County School District to provide the second doses for those individuals that were vaccinated right before the Christmas break. These vaccination pods are held on the school campuses, and they're specifically for the 5 to 11-year-old age group. We will be doing the second doses, but we'll also continue to offer new first doses at those operations. The difference will be the second doses need to be scheduled either at our future locations, which may be the Reno Sparks Visitors and Convention Authority down south, or at our clinic or any one of our other community pods. That's really the information I wanted to get out there today. I appreciate everyone's time. And I just want to remind everyone that our operations are closed this Friday in observance of the holiday. Thank you.
Thank you, James. And now we will go ahead with Kevin Dick, District Health Officer in Washoe County. Kevin, go ahead when you're ready.
All right. Thank you, Yura. I want to thank everybody for being here today and wish you happy holidays. And I also want to thank Bob Conrad and Mrs. Reno for recognizing Scott Oxford as Communicator of the Year. It's very well deserved. Scott's done an outstanding job for our community throughout this pandemic. So I appreciate that recognition. As far as the Omicron variant, last week we reported 2 initial cases of COVID-19 Omicron variant in Washoe County. To date, there have been 16 Omicron cases that have been confirmed. The ages range from 19 to 70 years. Out of the 16 individuals, 14 of them had completed the primary series of COVID vaccinations, and 2 had received their booster shot. One individual does have underlying health conditions, but none of the individuals have been hospitalized. So the best course of action is to be vaccinated and boosted. Vaccinations continue to provide protection from hospitalization and death, and the boosters are effective in reducing symptomatic infections. We expect to see increased cases of Omicron. The state lab is now finding more than 20% of the samples that they are genetically sequencing are Omicron, and that number is growing fast. Our COVID-19 cases and hospitalizations are increasing in Washoe County as well as Nevada as a whole. Our 7-day moving average is at 127.6 today. That's a 32.5% increase since last Wednesday and a 70% increase since our low of 75.1 on December 19th. That's just a week ago Sunday. Since then, we've had a 70% increase in cases occurring here in Washoe County. We're also seeing an increase in positivity rate. The state's county tracker positivity rate is at 6.5%. As a reminder, that is a 7-day lag and a 14-day average. So as James English pointed out, with the high positivity that we're having at our testing at the post, we expect to see that positivity rate continuing to increase here into the future. COVID hospitalizations in Washoe County now stand at 59, and overall our Washoe County hospitals are above 80% of their staffed bed capacity. CDC continues to have Washoe County categorized as high transmission for COVID-19, and mask requirements are in place here in Washoe County. The CDC issued new guidance regarding shortened in-home isolation and quarantine on December 27th. We are following this new guidance, but the guidance that we're providing is subject to change as we're receiving more information. We just received a technical bulletin that was issued by the state shortly before this briefing. I've not had a time to fully read that yet. And Dr. Dow is on a briefing call with the CDC right now on the new isolation and quarantine guidance. So I'm sure everybody has seen that in the news, and we will be implementing that here. And just as with the Christmas holidays, New Year's is now approaching. And so again, it's important for people to consider how they're going to celebrate and how they're going to be safe. The safest thing to do is avoid gatherings, especially large gatherings and gatherings with those outside of your household. The safest thing is to be vaccinated and boosted for COVID-19 and avoid gatherings with unvaccinated guests. Rapid at-home tests are a good option to use before gatherings, but please don't assume that you're COVID-free if you're feeling sick and a rapid at-home test comes back negative. If you're sick, stay home, and we recommend that you get a PCR test to have the most accurate test to understand whether you have COVID or not. And keep in mind our elderly populations and those with underlying health conditions that we know are at increased risk. Also, a reminder is classes resume next week for people to stay home if they're feeling sick. Please don't share any disease that you have with others and be cautious. Lastly, I want to recognize James English, Regional Operations Chief for our COVID-19 response and vaccine deployment. He's been a vital team member in responding to COVID-19, and he's been in this role since September of 2020. He'll be transitioning out of his role as regional ops chief to resume his regular duties in environmental health services after the new year. He's done a remarkable job for our community. His dedication and the time, energy, and passion he's put into his role is remarkable. Thank you, James, for all of your hard work. With that, I'll turn it back over to Yara.
Thank you, Kevin, and thank you, James, as well. With that, I'll open up the floor for any questions from the media. Please direct your questions to the person you want your response from. Thank you.
Hi, this is a question for Kevin. I'm looking at the test positivity rate, and it looks like we're about 1.5% away from the World Health Organization threshold. That seems like encouraging news. Will that effectively drop the indoor mask mandate for people who are vaccinated if we reach that 5% threshold?
So, Bob, the way the mask requirements work is it depends on both the number of new cases per day over a 7-day period per 100,000 population, and the test positivity rate. And if either one of those is over the CDC threshold, then the mask requirement is based on the higher threshold that you would have for either the cases or for the positivity. And so we're above the CDC threshold for cases. And the number that you see, that 6.5% that the state is using in their county tracker, that's a 14-day average with a 7-day delay. The CDC also has a county data tracking system, and they look at test positivity over a 7-day period, the last 7 days. And they currently have Washoe County over 13% on test positivity. And that's why when I talked about that number, I did caution that we do expect to see that state county tracker test positivity going up because it's got that lag period, and we're experiencing higher positivity rates now that are occurring.
Okay, so still quite a ways to go, it sounds like.
Yeah, and it appears at this point that we're not moving in the right direction for getting rid of the mask requirements, as we're seeing increasing cases and increasing positivity.
Thank you.
Thank you.
Hey, Kevin, this is Jonah Dillon from the Review Journal. I feel like I ask you this every week, but I wanted to ask about hospitalizations and about the numbers. Obviously, they've been going up, but we have heard that Omicron is maybe less severe in a lot of people. So where are you sort of with your concern level over the hospitalization numbers right now?
Well, we are seeing them going up. And while we are seeing increasing cases and we are seeing the percentage of the variants that are identified being Omicron increasing, we're still have most of the cases that are genetically sequenced are still Delta. And so we know that Delta is a little more severe. I suspect that most of the hospitalizations that we're seeing now are probably those Delta cases. As far as Omicron, I'm cautiously optimistic. The early indicators are that Omicron cases are not as severe and not as much hospitalization is occurring. But I think we really also need to get some more time under our belt and continue to study that. And I hope that bears out for us.
Kevin, this is Leanna with Channel 4. I was wondering if you could talk to me a little bit about the testing kit availability. I've been seeing in different parts of the country and the region that there are a low number of them and that people are having a hard time being able to find these at-home testing. And then following up on that, I guess how confident do you feel that these at-home testing kits are in detecting for the Omicron variant in comparison to the other ones?
I guess I would refer that question, the last one, probably to Dr. Pandori at the state lab. I really am not familiar with any studies on how effective the the rapid testing is in detecting Omicron. I suspect that since it's looking at the antigen response, it probably is responsive, but I would refer that question over to the State of Nevada Public Health Lab and see if they have any additional expertise for you in that area. As far as the availability of the test kits, I think that's what we're seeing in the news nationally, is that they are limited supply right now, and the federal government has pledged to be purchasing and distributing 500 million of those that should be available in January. The county is also working on some plans to be standing up some additional community testing sites in conjunction with a private vendor that they're working with, and we expect to be announcing more information on that here in the next week or two.
Thank you. And then I also saw that Nevada's COVID pill supply was, we've received a first shipment that was only enough for about 480 people. Do you have any information on, I guess, whether or not Washoe County is going to be receiving any of those, and how that will determine how to distribute such a low amount?
I anticipate that Washoe County will be getting some of those, but I don't have detailed information on that. I believe that that is a question that's probably best referred to the State Board of Pharmacy.
Hey, this is Lucia Starbuck with KUNR. This is a question for Kevin. What do you think the increase in cases is attributed to? And do you think it's a spike, or do you think we're about to see like a positive trend, a positive increase?
Lucia, I think that the increase in cases is probably attributable to a couple of things. One is the holiday season. And while I think it's early to be seeing some of the impacts from Christmas gatherings, we all know that there are holiday parties that occur in December ahead of Christmas. And so I would anticipate that there are probably more people that are out mixing and gatherings that are providing opportunities for transmission. And then I think overlaid with that are the cases of Omicron that we're now seeing occurring in Washoe County. We know that Omicron is much more transmissive. And so I think that part of our increase is also Omicron cases that are occurring. So I think we're seeing both of those things, and I don't think this is a short spike. I think what we're going to see is a continuing increase, particularly as we have more Omicron cases happening, and we're seeing more of the cases that are resulting from holiday gatherings.
Thank you. And can you talk a little bit about what James English brought up, that you saw the largest test positivity rate on Monday at your guys' testing site? Can you elaborate a bit on that?
Yeah, we traditionally have a larger test positivity occurring at our testing because we are filtering and really seeking to provide the public health testing that's for symptomatic individuals, people that are close contacts of confirmed cases of COVID-19, and also now people that are recently returning from international travel. So we've seen, I think it was last Wednesday's testing, we also had a fairly high number at 21%, but the 37% that we saw in the testing that we did on Monday, 37% positivity was the highest that we've seen so far coming through our posts. So, that tells us that the people are symptomatic, people that are close contacts, perhaps some of the international travelers definitely are finding out that they do have COVID-19.
Thank you.
Okay, do we have any more questions?
I've got to go back on the positivity. I think the other thing that we should mention is we also have people coming through our post that were tested somewhere else and they may be a close contact to an Omicron case, and we're having them come through so that we can test them so that their results can be genetically sequenced at the state lab. Whereas if they were tested somewhere else, their samples may not be available for that. So we could have a little bit of a assaulting effect there, where we're having people come through that we do know are positive because we're having them sampled for genetic sequencing of those results at the state lab, genomic sequencing.
And actually, Kevin, this is Jim. I should have made that clear. Our original positivity rate was just over 41.4%. So when you pulled out the genetically sequenced, we were at 37.9.
All right, thanks, Jim. Appreciate that.
I know you guys said that you guys are going to be on the phone with the CDC to talk about the new isolation guidelines, but do you have any information or any context into how the science behind this shortened isolation period, given the rise in cases? It's a little confusing.
Well, I think that the CDC was their attempt was to adjust their guidance that hadn't been updated in I think it was 17 months or so. In light of what we're seeing, what we saw with the Delta and what is now being seen with the Omicron, in that the period that people were taking once they'd been exposed to being infected and symptoms developing was shortening from 5 days to 4 days with Delta to now 3 days that's being estimated currently for Omicron. And also the number of people that are now vaccinated that are able to recover much more quickly, not shed as much virus, et cetera, and the Omicron appearing to be less severe as far as the longer term disease transmission. So I think they were trying to balance all of those factors with the economy, with needing to keep things moving, with the fact that we were moving through this pandemic from a period previously where we really didn't have any vaccination available. We did not have effective treatments to the scenario that we're in now, where vaccinations are available, widely available to everybody 5 years and older, and the new information that we have about the disease.
And last question. For children under 5, I've seen also that those hospitalizations for that age group have increased in parts of the country. I was wondering if you knew, I guess, how the Omicron variant reacts, or how does it manifest itself in kids under 5, I guess, differently than other age groups, if you know.
I don't have any information on that for you, but I do know it's been widely reported that we're seeing increased cases occurring in children, and I think that's reflective of both the higher transmissibility of Omicron and the lower vaccination rates in those age groups.
Okay, are there any other questions? Okay, well, hearing no more questions, I will conclude this meeting. But before we do, just to let you know, we are recording this meeting, and we will be posting it on COVID-19 Washoe webpage soon. If you don't see it by or before your deadline, you can always email me. My email is ydebabila@washoecounty.gov, and I would be happy to send you the file directly. You can also reach out to me if you have any additional questions not covered today. So thank you for your time and have a good day.
Happy New Year, everybody.